Hey guys, welcome back to my channel. Let's discuss important topics for BDS first year final exams in anatomy. Under scalp, layers, nerve supply, venous drainage, lymphatic drainage, blood supply, and applied aspects can be asked. Dangerous area of scalp, black eye, and emissary vein can come as a separate question. Under face, nerve supply, blood supply, venous drainage, lymphatic drainage, muscles of face, facial artery, dangerous area of face, and Bell's palsy can come as a separate question. Orbicularis oculi, its origin, insertion, action, and its nerve supply can be asked. Of its three parts, investing layer of neck, its attachments, and then carotid sheath can be asked. Also, external jugular vein can be asked. Under posterior triangle, boundaries, roof, floor, contents, that is nerves and the vessels, lymph nodes of the occipital triangle, subclavian triangle can be asked. Muscles forming the floor can also be asked. Under sternocleidomastoid, origin, insertion, nerve supply, and its relations, made superficial or deep relations, and its blood supply and actions. And in applied anatomy, that is torticollis or Wryneck syndrome can be written. In anterior triangle, its boundaries and its subdivisions, that is carotid triangle, digastric triangle, submental triangle. Any one of the triangle can be asked in detail, its contents and its particular boundaries. Ansa cervicalis, lingual artery, external carotid artery, and then infrahead muscles can come as a separate questions, be it 5 marker, 2 marker. Location, external features, relations. About parotid sheath, parotid duct, that is Tenson's duct. Contents, blood supply, venous drainage, nerve supply, and applied aspects can be asked. It is one of the most important 10 marker. Muscles of mastication is one of the most important 10 marker for BDS students. In it, masseter, temporalis, lateral pterygoid, medial pterygoid should be explained under origin, course, insertion, its blood supply, nerve supply, actions, and sometimes relations too. With diagrams. Maxillary artery is one more important question which can be asked for 5 marker about its branches, its diagram and all. In mandibular nerve, course and its branches can be asked, applied aspects can be asked, and then most important about trigeminal neuralgia can be asked. Sometimes questions can be asked from maxillary nerve, its course, relations, and branches. One of the most important 10 marker question for BDS students is temporomandibular joint, under which ligaments, its articular disc, relations, blood supply, nerve supply, lymphatic drainage, movements of temporomandibular joint and its mechanism, and the muscles which produces these movements and its applied anatomy can be asked. Digastric muscle, mylohyoid muscles, hyoglossus muscle, which come under the submandibular region. Under each, its origin, fibers, insertion, nerve supply, action, and its relations can be asked. Submandibular gland is again an important 10 marker question, under which deep relations, innervations, superficial relations, secretomotor pathway, position, and its histological structure can be asked. Additionally, core structure and opening of submandibular duct, microscopic anatomy diagram of submandibular gland can be asked. Thyroid gland is again an important 10 marker, under which location and extent, external feature, relations, arterial supply, venous drainage, nerve supply, histology, development, clinical anatomy can be asked. In embryology, development of thyroid gland is an important question. In histology, thyroid gland, the histological diagram is an important question. Under internal jugular vein, its origin, termination, its diagram, clinical importance, that is applied anatomy, tributaries, relations can be asked. Styloid apparatus is an important 5 marker, in which the muscles and ligaments attached to it, innervation and features can be asked. Under suboccipital triangle, the boundaries and its contents are important. Under cranial cavity, fox cerebri is an important question. Its diagram and its boundaries, its margins, and the sinuses present in it can be asked. Cavernous sinus is one of the most important 10 marker, which has repeated several times in that situation, boundaries, contents or relations. Its tributaries and communications can be asked. Superior sagittal sinus is a very important practical question which comes under surface anatomy, where we have to draw it on the mummified body. Extraocular muscles, which can come for 10 marker or 5 marker, its origin, insertion, nerve supply, action of all the extraocular muscles can be asked. With its diagram, the recti muscles can be asked, and then a short note on oculomotor nerve can be asked. Soft palate is again an important question. It can also come for the practicals as a gross anatomy discussion topic, in which structures, its muscles, nerve supply, blood supply, lymphatics, applied anatomy can be asked. Valde's ring can come as a short note. Under palatine tonsils, its position, external features, tonsillar bed, nerve supply, blood supply, applied anatomy can be asked. Under pharynx, its muscles, its nerve supply, constrictors of pharynx, their origin, insertion, nerve supply, actions of it. Pharynx as a whole can be a 10 marker, be it its boundaries, paths, structure, blood supply, venous drainage, lymphatic drainage. Mechanism of deglutition also can come under it. Under nasal septum, its formation, gross anatomy, that is, blood supply, nerve supply, applied anatomy can be asked. In lateral wall of nose, all its parts, and most important is its openings with its respective diagram. Under paranasal air sinuses, they can ask to name all the paranasal air sinuses, and then maxillary sinus in brief about its situation, boundaries, communication, nerve supply, blood supply, and applied anatomy, sometimes development also. Under larynx, cartilages of larynx, cricoid cartilage, nerve supply of larynx, vocal folds, a short note on vocal folds, and about piriform fossa, its clinical significance, and muscles of larynx can be asked. Tongue is one of the most important 10 marker that can come for exam long question type, in which position, parts of the tongue, muscles of the tongue, blood supply, and then venous drainage, lymphatic drainage, nerve supply, and applied aspect can be asked. Development of tongue, anomalies of tongue, muscles of tongue can be asked as a short note also, and then taste pathway can be a question, and then histology of the tongue, that is all the three papillae can be asked. For final exam, there's going to be one question from embryology for sure, which can be spermatogenesis, oogenesis, fertilization, neither significance of fertilizations, notochord, about the pharyngeal arches and derivatives of first pharyngeal arch, of the second pharyngeal arch. Short note on Meckel's cartilage, there can be 5 markers for development of face, development of tongue, development of palate, and then derivatives of neural crest cells. Under osteology, there can be questions, for example, structure passing through foramen ovale, structure passing through foramen magnum, 2 markers on bregma, asterion, pterion, its significance, structures passing into internal auditory meatus, and about pterygomaxillary fissure.